like this when I feel incredibly ignorant and very humble. So please forgive me for not being able to speak Norwegian, but I am trying to learn the language, but it's a very slow job. I'm from Newcastle, and I have a particular dialect. It's called a Geordie dialect, which is a very fast dialect. So if I trundle along very fast, then just put your hand up and I'll slow down, and I apologise for that. And to make it worse, I worked in Australia for 16 years, 13 of which were in the health promoting school area. And I've been back in England for about 18 months. So if I go up at the end of the sentence, that's a little bit of an Australian ism in there. And what Bjarne forgot to mention was that we're more than happy to take questions, but they have to be in English. Just a point on physical activity. I think it's fantastic that you have physical activity in schools as a priority. My little son, who's 11, he goes to a primary school, and he's been told he can only run around in the playground on a Thursday lunchtime if it's not raining. You can imagine how many times he gets to run around. So please make sure that your physical activity is spread right across your school. Bjarne and I did have a chat, more than a chat really. We had a planning session about what we were going to do today. And Bjarne's work is terrific on action competence, and it fits in really lovely with your competence for life. The work that I'd like to present is some of the broader thinking that we're trying to get involved with, and includes areas of social theory, if you like, about governmentality, about complexity. And I'd like to finish off by talking about a particular approach to evaluation that we're using, called realistic evaluation, which we're finding very fruitful. The sign from Bjarne's health promoting school, the teacher, if he'd been in Australia, he would have been going to the beach, and I'm sure if he'd been in Denmark, he would have been going to the bar. I'm not sure where the Norwegian health promoting school person goes to. So some of the reasons why I'm interested in governmentality and complexity and different ways of thinking about health promoting schools arises out of a series of frustrations, if you like. The first frustration for me is that I don't think the potential for health promoting schools is being realised. I've worked really closely with health promoting schools, and one in particular in Australia, in Victoria, for 5 or 6 years, and I consider that to be the best health promoting school anywhere, because health promotion, or the health promoting school concept, is integrated into the very daily workings of the school. So when we talk about participation, for example, we actually talk about the school community participating. And in Victoria, we didn't talk about schools, we talked about school community. And that, for me, is a very important message. It sends a particular point across. So I don't think that the potential for health promoting schools being achieved. I also think that the partnership between health and education can be fruitful, but it can be fraught with disasters. Absolutely fraught with disasters. I know of one particular health promoting school partnership where the Director of Public Health, have we got the Directors of Public Health here? Where the Director of Public Health wanted to find out what was going on in schools in relation to sex education. You would think you'd pick the telephone up and talk to the coordinator of the local Healthy Schools project. No, she wrote to all the ministers of religion. She wrote to the Catholic Archbishop. She wrote to the local rabbi. Goodness knows why. It's that sort of problem. And Bjarne was talking about communication. Communication is incredibly important with partnerships. And I'm not really that convinced that we understand enough about partnership per se to actually make health promoting schools as positive as possible. There's a lot about education and schooling that health people don't know. And there's a lot, and I think really got to work much harder at making those relationships. We're trying new ways. We're trying to think about health promoting schools differently. Even if it is to think about a health promoting school as a health promoting school community, that for me is fantastic. We're trying to think about it differently. We're trying to look at the broader political, social and cultural issues surrounding within which health promoting schools are located. So we're trying to look at things like governmentality, complexity and realistic evaluation, which I'll talk about in a second. Now, what's been happening across the Western world, if you like, is that there's been a whole move to the right. I think it's me. I think it's definitely me. I went to Australia, I went to Queensland, and there was a Conservative government there who passed a law that says that you couldn't meet in groups of more than 3 in the shopping mall. So can you imagine taking your kids shopping? And officially it was illegal. The whole thing had gone too far. It was called the Queen Street Shopping Mall Law, and you could be locked up for meeting in more than groups of 3. So there's been this massive move to the right across the Western world, Australia, New Zealand, America, Canada, and also Europe. In England, we have a Labour Party in power, and it's the most right-wing Labour Party I've ever known. I'm sure you're aware of that. And with that brings certain issues. The Article Charter. It's actually unfashionable now to talk about the Article Charter. Article Charter was developed in 1986, so it's an awfully long time ago. It seems to have gone out of fashion. But for me, the reason why I've got it on this overhead is that it just reminds us about the range of possibilities with the health promoting school. So health promoting policy, Bjarne mentioned this. How many schools, how many school communities have health as a priority right across the range of things they do? Creating supportive environments by utilising the setting of the school to encourage reciprocal support between teachers, pupils and parents. In England, they've realised that parents are really a valuable resource. So now the government's trying frantically to think of ways to get parents back into schools. When I was teaching in the 80s, parents were part and parcel of what went on in schools. They've been shunned over recent years, and now the government's trying to get them back in. Strengthening community action. Bjarne's projects is lovely in that sense. Again, let's look at the sorts of skills that we can look at from other actors. Developing personal skills. Again, Bjarne's areas there is really nice. It's not just about knowledge and behaviour, it's also about applying those within their environment, within their local context or community. And reorienting health services. We're doing an evaluation of a project that has 70 school nurses in it. We've got school nurses here? No. No? School nurses. But they tend to work in the traditional way. Let's look at how we can work differently with school health nurses. These are the sorts of context issues that we need to understand before we can engage in health promoting schools from my perspective. And I'm more than happy for people to have a chat later on. No problem there at all. So we've got corporate managerialism, and I'm working at a university that has these sorts of problems as well. Productivity, growth, efficiency, accountability, key competencies, and I think that's used in a slightly different way. There's a bit of slippage in the language here. Centralisation and decentralisation occurring at once. In England, we have terrible centralisation of curriculum. Literacy, numeracy, science. Somebody mentioned home economics earlier on. Home economics isn't taught as a subject anymore in England. It's gone. It doesn't exist. So they're the sorts of issues there. We also have particular trends in education. We have things like an ageing workforce, that of course can be a strength. Increased demands placed on schools and teachers, the different sorts of work that teachers are expected to do. Fluctuating retention rates, when children are allowed to leave, do they actually leave, and so on. Limited opportunities for professional development for teachers, severe shortages of teachers worldwide. In New Zealand, they cannot get men to train to teach in the primary school. No men are training in the primary school, and it's because of the threat of allegations of sexual harassment or sexual abuse. Just the very threat is stopping men going into the profession. Now, I think that is really, really sad for a whole variety of reasons. Changing roles and expectations of teachers, parents, and school communities. Again, let's look at school parents getting involved. And an increased recognition of the role of technology, especially multimedia and digital media in particular. We have projects happening in Hull that are absolutely mind-blowing in their impact in terms of children's learning, children's construction of knowledge, participation, teachers' roles. Teachers actually don't need to go to school. They can respond electronically to children. So there's a whole host of issues happening. So governmentality. The reason why I turned to governmentality to try and explain some of the things that were happening in health promoting schools, because I couldn't explain it. I don't think governmentality is the answer, but it gives me in particular a way of thinking about health promoting schools. Deborah Lupton, who's head of the research centre at Charles Sturt University at Bathurst, she's head of a centre for the study of cultural risk, really interesting centre. So she suggests that governmentality incorporates both techniques or practices of the self-government. So we get up in the morning and we go for a jog, we look after our nutrition or our meals, we don't smoke, we don't do drugs, and so on. Self-government. And the more apparent forms of external government. Policing, surveillance and regulatory activities carried out by agencies of the state or other institutions and other individuals for strategic purposes. So we are governed, if you like, and we also govern each other. Governmentality involves strong coercive elements towards the normalisation of health promotion activities. And I'm sure this isn't new to you. So it's normal practice for us to wake up tomorrow morning after the dinner and go for a walk or a jog or a swim or a spa or whatever. The normalising of health behaviour is quite prevalent, and governmentality allows you to think about that. This point here, the governed individual or the governed school will happily control him, her, itself. No direct force is needed. So governmentality is like a network, it's like a web, if you like, of influences on each and every one of us, on each and every institution that we're part of, that we will govern ourselves to adopt healthy habits, behaviours, and so on. Now I'm going to put a couple of overheads up here that have got a lot of words on them. Don't worry, don't freak out or anything. The main columns, the left one and the right one. The middle one has a lot of words in it. For me, governmentality is about three things. It's about governmental rationalities, ways of thinking. Why do we think about the health promoting school the way we do? And what are the different ways of thinking about the health promoting school? So these are just some of the terms that are influencing the way that we think about health promoting schools. So we've got individualism, or healthism as it's often termed. Environmentalism, socio-ecological, marketisation. Some health promoting schools are very interested in becoming health promoting schools simply to market themselves better. We've got school improvement, school efficiency, school effectiveness, professionalisation of teachers. I'll put all the words up now, but just skim through them. So we can think about health promoting schools in a whole variety of ways. At any one particular time, one of those rationalities is in the ascendancy, if you like. So we can talk about, if you want to use the term discourses, we can talk about there are different discourses of health promoting school. And at any one particular time, there's a dominating discourse of health promoting school. Now, it's up to you folks to think about, how do I think about health promoting schools? Why do I think about health promoting schools in that particular way? And what am I bringing to it as an individual and as a practitioner that reinforces that particular way of thinking about health promoting schools? Now this next one is interesting. So we have governmental rationalities. The next one is governmental instrumentalities, if you like. Who encourages us to think about health promoting schools the way we do? So here we've got the varied alliances between political and other authorities that seek to govern economic activity, social life and individual conduct. Who is it who is encouraging us to think about health promoting schools this way? We've got the World Health Organization, of course, has been very, very active in promoting the health promoting school. We've got funding agencies like National Health and Medical Research Council. We've got the European Health Promoting Schools Network, and to our governmental ambitions. So a whole range of technologies that are used, and here we have some of them on the right-hand side. They take a number of forms, they work in different ways. In England we have an award scheme. We're just about to start an evaluation of the Liverpool Healthy School Award. Each local authority in England has an award scheme to encourage schools to take part. In the Western Pacific region there was a gold, silver and bronze award scheme. We've got things like criteria. Bjarne mentioned 12 criteria to be part of the European network. There are so many different lists of criteria, if you like. There are checklists, there are performance indicators, and so on and so forth. There are many, many ways of going. This last point here, we've just written a paper in Australia on teachers' health and teacher stress, trying to use a governmental framework to look at this. And what we found was that the Victorian Department of Education, they had coined the term professional health to try and link health of teachers and them being and embodying a professional. We thought that was particularly dangerous, because the opposite of professional health is, if you're professional, you're also healthy. If you're unhealthy, it means you're unprofessional. Now we found that particularly dangerous, and that's why we wanted to write a paper on that. So if you come across that term, professional health, be very wary. There was also a lot of pressure on managers in schools, head teachers, to manage teachers' health efficiently. So they were being judged on how they managed teachers' health and stress. And it was a managerial task for them. So there's some issues there that make us think twice. So having said all that about governmentality, and having listened to Bjarne, and having experienced schools as a teacher, as a parent, do you have school governance here? School council, where parents get involved in the management of schools? Yeah. As a chair of a school government of a primary school for 5 or 6 years, I've seen schools from a whole variety of different ways. And I've always been, I've been curious about why, when we try and introduce activities into schools, we really don't reflect the complexity of schools through those different activities. So schools as complex adaptive systems, and this is a nice metaphor, if you like. It's like an ecology. It's like an ant colony, or it's a pond down at the beach, with seaweed and crabs and fish and the whole lot. I try to think of schools like that. So in an organisational context, complexity provides an explanatory framework of how organisations behave. That's interesting. How individuals and organisations interact, relate and evolve within a social ecosystem, larger ecosystem. Complexity also explains why interventions may have unanticipated consequences. How many times have you gone into schools for one thing and you find out that X, Y and Z have happened? A full number of times. The intricate interrelationships of elements within a complex system give rise to multiple chains of dependencies. Multiple chains. When we go in and we come out, we don't get a sense of those dependencies and those relationships. Change happens in the context of this intricate intertwining at all scales. So I'm urging anybody who goes into schools to work in health promoting schools to actually think about all of those hierarchies, all of those relationships, all of those boundaries, all of those things that make schools complex places. Schools aren't black boxes, but quite often we think of them as black boxes. So we know what the input into the black box is, and we know what the output out of the black box is, but quite often the box itself is a mystery to us. And what I'm appealing as much as I can is that we really need to open up that box and say, right, let's get into the box and find out what's going on in there. As more and more professionals work in, through and with schools, there is a growing need to understand more fully the way health promoting schools function. At the airport the other day while I was waiting for my connection, I just wrote down a list of all of the different professionals who I know are working in schools, and I'm sure there's a whole stack more that you folks can add to this. Psychologists, mental health coordinators, homeschool liaison officers, welfare officers, speech therapists, social workers, sociologists, critical incident specialists, nutritionists, digital media consultants, networking analysts, web page designers, youth workers, artists in residence, police in schools, community development workers, classroom assistants, and so on and so on. We also have different projects like school-focused youth services, full-service schools, extended schools, community schools, education action zones, health action zones. These are all in. You can see massive possibilities there, possibilities for confusion as well. So I think the message really is the more we can understand the messiness, the complexities of schools, the better. Some would say there are principles of complex adaptive systems. And I've put these principles up here from an article by Plesk and Greenhoff, and I'm more than happy to provide the reference for that later on. Complex adaptive systems include a collection of actors, we've just said, who are able to act independently and interconnected. Schools often have fuzzy boundaries. We've talked about the notion of school community. What on earth does the term school community mean? We use it a lot, and we don't have good definitions. Complex adaptive systems often do not recognize internalized rules and regulations. Sometimes they develop their own rules and regulations, and often these aren't explicit. And you don't find out until you've accidentally tripped over something in school. Often unplanned, unshared, and irrational activities occur within a complex adaptive system. Non-linearity and unpredictability are frequent features of schools. Non-linearity, we start a project here in a school, we expect to evaluate it here, but in a sense the school's gone all over here. And when I say school, I mean all of those participants within the school. In relation to education versus health, complex adaptive systems are often embedded within other systems and often co-evolve. So the health system is a massive system. It's not just about health people who work in schools. They have things like service agreements, which often schools don't understand. Now I've got an example here of a project that we're going to evaluate starting from next week. The city of Hull, where the university is about 300,000 population. The head of the council has decided that he would like to introduce free school nutrition, free school meals to every single primary school child. 25,000 children will receive breakfasts, lunches, and after-school snacks if they want them. At the minute, lunches are only available for children whose parents are on the dole or unemployed or receive a pension. So this is quite innovative, it's quite exciting. It's going to cost, in 3 years, it's going to cost nearly £4 million. Just to give you an example of the complexity of one councillor deciding this is what we're going to do. In all of his justifications, he's made an explicit link between health and eating, and school attainment. Now, as far as I'm concerned, the jury is still out on that. We don't have the evidence necessarily to show a good, robust relationship. No one knows where the money's going to come from for this. Over 6 years, it's 7 million. You can imagine the rumours that are circulating around Hull. My tax is going up by £50 a year to pay for this. Teachers are going to have to take a pay cut to pay for this. Where's the money coming from? Our bins will only be emptied once a fortnight rather than once a week. So it's causing all sorts of anxieties and tensions. Not all the schools can start at once. The schools with kitchens will be starting first. They've already implemented a healthy menu. It is so funny, so funny. And they've gone from burger and chips to lentil pancakes, lentil moussaka. And of course, the parents are up in arms. I was in a meeting with the Director of Education when a parent rang up and said, I want my son to have burger and chips. So the head of education, Director of Education said, well, give him them at home. He's not having them at school. The media has been involved. No consultation, by the way, none whatsoever. Participation. Wouldn't you think the kids could have had input into developing the menu? Wouldn't that have been the most obvious thing to do? We need an increased number of canteen supervisors. How are they going to be appointed? Who's going to appoint them? Who's going to pay for them? We need an increased number of volunteers to wash the fresh fruit, to distribute the fresh fruit. We need an increased numbers of school crossing supervisors because we're going to get more children coming to school early in the morning. This is the one that's really got the teachers. Teachers are furious about this one. We need to lengthen the school day because we have 2 sittings at lunch. Some children who do qualify for free school meals are saying, I'm not eating this rubbish. I'm not eating lentil pancakes. I'm really sorry, I want my burgers and chips. So that's causing all sorts of problems. The head teachers are complaining. This is another budget we have to manage. We have too much money as it is, all in different pots to manage. It's not the money that's the problem, it's the managing the money. Health and education relationship partnership is tenuous. It doesn't exist. The nutritionists within the health promotion area have got no money. They're on a different budget cycle to education. So they wanted to do an nutrition education flyer for the parents. They had no money. They had to ask education to provide them with money. And education said, no, you're not having it. So it's a real problem. That's just one example where one councillor decided we want one project. Imagine all the other curriculum areas. Imagine all the other areas that schools are involved with and how complex this thing can be. Very quickly, this is another frustration I have, and I'm sure we have some experts in randomised controlled trials here in the audience. I find randomised controlled trials really, really frustrating because I don't think they grasp the complexity of schools. Now, when we talk about complexity in schools, we're not trying to manage complexity. We're actually trying to celebrate complexity, celebrate diversity. And that's a term that you might have heard in the health promotion area. But I think that's really important that we do that. We don't look at complexity and try and manage the variables, if you like. We're trying to bring those variables out in different ways. This notion of realistic evaluation comes from a book called Realistic Evaluation that I discovered for myself when I arrived in England. It's been going since '97, I think, so it's not a new book, but I've discovered it for myself and I've found it really useful. They talk about context, mechanism, and outcome, and that's a nice equation, if you like. They talk about CMO, configurations, relationships. So in terms of context, we need to understand for whom and in what circumstances we program in schools. Who does this work for within that school community? Context refers to spatial, historical and institutional locations of social settings and the norms and values and interrelationships. The mechanism, I think of mechanisms as processes. So we need to understand why a program works. Mechanisms are always contingent on context, so particular processes or mechanisms occur in particular contexts. Outcomes. We need to understand what are the outcomes of any initiative and how they are produced. There may be multiple outcomes. Outcomes are analysed to discover if the conjectured context mechanism theories are confirmed. So we're using this to try and identify the CMO relationship within different evaluation projects. And this is one that we're looking at here. So the Liverpool Healthy Schools Award has been going for a few years now, and they've got about 200 schools involved in the award, primary and secondary. This paragraph is nice because it brings those context, mechanism, and outcomes all together. So central to such an approach is answering the question, what works for whom in what circumstances? The notion of works is defined by the participants within the context. More specific questions could include, does the Liverpool Healthy Schools Award work? Again, the definition of work is from the participants. Under what circumstances does it work? For whom? How do the Liverpool Healthy School Award programs work, and for whom do they work? And within such an approach, history and context are seen as key sources of influence. And that's really important, to try and get at the complexity of schools rather than being controlled for. So that's just an example of how we're trying to look at and use complexity with a broad understanding of things like health and environment and health promoting schools. Got to go. I've had language problems. So I'll finish there. But we think complexity, again, doesn't necessarily provide the answers, but it's keeping our evaluation and thinking going, and that's why we like it. Thank you.